Roberts nursing is different. We hear it all the time from people outside of here that Roberts nurses are different, and I really think it's that holistic aspect that we reinforce. It's the caring that we reinforce. It's the acknowledgement that people are people and that we need to spend time getting to know them as a whole person to meet whatever needs they have. One of the aspects of our program here at Roberts is to build, grow holistic nursing students. We don't look just at a diagnosis. We don't look just at a task. We look at patients as a whole. What are all of their needs? And I really think our students are very open to the fact that patients have spiritual lives, patients have emotional lives, besides the physical and the medical issues that are going on, that the students are very open and very caring. And so we talk about that caring aspect in all aspects of how we intersect with patients' lives. I think people need to realize, and this is another aspect, we emphasize caring for our patients, but I also think that we as a School of Nursing are very caring of our students. I know I came here as a master's student and felt very supported and very cared for in that program. And then eventually when I was asked to come on and teach, I feel like we give that back to our students, that we're just a very caring program, caring people, caring faculty, caring staff members, that whatever's going on with students, we treat them holistically just like we treat our patients holistically. I've taught many classes, different classes, and there's aspects of each one that I enjoy. Right now, probably the one that I enjoy the most is teaching community health to the senior nursing students. Community health is really about all the places outside of a hospital that we provide care to patients. And in this day and age, the majority of healthcare occurs outside the hospital. So helping students explore that and realize that there's a whole world of healthcare out there and nursing out there that they didn't know about is cool. I've been working with a nurse researcher at University of Rochester on a medication deprescribing study for the elderly. And so for the past 2 summers, we've been making home visits to patients after they've been discharged from the hospital, looking at medications very stringently to see, are medications interacting with each other? Are there too many medications that they're taking? Working with a pharmacist, working with a physician, and the whole study is really geared around, are patients getting the appropriate medications once they leave the hospital? Nursing takes passion. It needs to be a passion. It's not just a job I want to do because I know I can get a job and it pays well. The whole profession dedicated to our patients requires such dedication on our own part that it takes a passion for really wanting to do the job. And it's a wonderful profession. I've found it deeply rewarding in all the years I have been part of the profession, but you have to have the passion for it.